Hello, welcome back to another episode of What's Up Doc. As you can see, I decided to do this in my living room, hoping for you guys to meet my babies. I have 4 cats. Here comes Oscar. I thought it would be more fun to do that since we are snowed in and nice and cozy up here. So what I wanted to do today is basically Q&A, question and answers, the most common questions that we get clinically. And I collaborated with Caitlin, my hygienist, and asked her about, what's the most common questions the patient will ask. And come on, Oscar. Come on, baby. Come on. All right. He might jump in a minute. So here we go. Let's just plunge right in. All right. What's the best mouthwash? The answer to that is not really one perfect mouthwash for everybody. It really depends on what you are trying to achieve. Are you trying to make, your mouth smell better, get rid of halitosis, dry mouth? Are you trying to keep your gums healthy? Are you trying to help remove plaques? So there's a lot of different applications to other mini mouthwashes. So there's no one specific mouthwash that we would recommend for everybody. So basically, again, we have to customize the recommendation depending on your needs. So that's the answer to that. Here comes Felix. Come on, baby. Come on. This is my black cat, Felix. Okay, he's right behind. Here you go. And this is Oscar. He's the ginger. I know this is really distracting. Oh, this is my little Oscar. Little baby. You baby Oscar. Little mama. Okay. And that's Felix right behind me. He's my John Wayne, if you know what I mean. All right. The other one, when the child should switch to regular toothpaste. The simple answer to that, when they can actually spit, because a lot of kids, younger than 7, they don't have the ability to spit out, and we don't want them to, swallow all that fluoride from a toothpaste. God forbid. All right. The next question is what we are measuring with the PerioPro. Oh, okay. So when you come in as a new patient or peri-maintenance patients, like I mentioned in my videos, whether you are placed in 6 months, 4 months, or 3 months recare system, we will probe. Probing is basically measuring the loss of attachments. Attachments are little fibers that attaches the gum to the root and the bone. And if you lose that attachment, then the numbers is going to be much higher than 3mm pockets. That's what we call pockets. So that's what we measure when we do perio probing. Perio, like I mentioned in my other videos, is everything that's around the tooth. Perio measurements, it should be perio pocket measurements, is we measure if you lose attachment. So if you measure between 1 and 3mm, you have healthy pockets, no attachment loss. If you measure 4 or 5mm, depending on the circumstances, we have to take into consideration and include any inflammation, include hormonal imbalances, medications, dry mouth, high plaque. It could be pseudo pocket, which is false pocket, and those are the false positive readings. So we will discuss it with you guys when you come in. And if you never had a 4 or 5mm pocket and all of a sudden you have 5mm pocket, we'll let you know why, or we'll let you know why we think you might have all of a sudden 4 or 5mm pocket. But that's what we measure. We measure the pockets. All right, next question. How do we know my pocket is 4mm? Well, what are we going to tell you? So we're going to tell you is if it's 4mm pocket, we're going to monitor, but we have to exclude or eliminate the factors that could be pathological condition. If it was, even if you cut yourself with like a piece of popcorn or bread, you might end up with a pocket that is bigger or deeper than 4 millimeter pocket. So there's a lot of different factors that will contribute to a higher reading with the perio pockets. Next question, what's the white spot on my tongue? All right, so there's no straight answer to that question. Could be a lot of different things. So if you see a white spot on your tongue or anywhere else in your mouth, and you think that you can actually rub it off or peel it off or get rid of it, then it's just probably plaque or piece of food. If it peels off, it could be an allergic reaction to a certain toothpaste or a certain, mouthwash, or you could be biting the inside of your cheek, or you bit your tongue, or you cut yourself with like I said, a piece of food. So, having a white spot on your tongue doesn't mean that there's something wrong, or you have a lesion, or, there's disease or condition. There are the structure and anatomy of the tongue, in the back of the tongue. Some people have it more pronounced than other patient, and sometimes that will catch on particles in food, and that's why we sometimes recommend for some patient to do the tongue brushing, combing out your tongue and cleaning out all that. So if you actually can remove those white spots, it's like I said, it could be food particles or biofilm. But if something that looks like a lesion and is changing in size or changing in color or changing in the way it looks, or it starts causing symptoms too. So if you don't have symptoms, it's probably nothing, injury. But if you start having symptom, burning sensation, throbbing or aching, and you can't even bite on certain things, then you gotta see your dentist or the oral surgeon. I thought the cats are gonna be jumping because every time I tape they jump, but this time I'm allowing them to jump. They're not gonna jump, just like kids. Okay, I hope that helped. Why is my crown sensitive? Okay, and I'm thinking that comes from patient that just had crowns seated. So those are brand new crowns. So there's no guarantee that you're not gonna have sensitivity. Remember, when you create a crown, you're cutting live tissue and you are, messing around with it, changing the shape, jetting so much cold water at it, putting all the kind of like medication around the gum to keep the gums nice and healthy and tight, so you can take compression, then you can put a temporary crown on it. So the tooth may, even if it wasn't sensitive before the crown, may get sensitive after you prep it for the crown. And everybody varies, every tooth varies. Like I would do a crown or 2-3 crowns on the same mouth. One crown would be okay, another crown would be a nightmare. So it depends on how the nerve innervation through the tooth is, the condition of that tooth, before we prep the tooth, if the tooth is compromised or we waited too long to put a crown on it. Or it could be your gums are just sensitive. Maybe you're brushing too hard around a new crown. So sometimes new crowns will take a little bit longer than 48 hours to settle down as far as sensitivity, especially cold sensitivity, and that's the most common one. I had a root canal tooth on my lower left side. It took 6 months for it to not be painful when I drank my coffee, and I think I mentioned that in one of my videos. But that's expected. That is not normal, but average, and we deal with it all the time. All you need to do is, if it becomes more persistent or consistent or gets worse with symptoms to the point that you can't even chew on that side, number one is your bite is off. So we have to adjust your bite first to calm the tooth down, and sometimes we'll combine it with a little bit of antibiotics or anti-inflammatory, and then we'll adjust your bite and we'll go from there. But putting a new crown on the tooth doesn't mean the tooth is never going to hurt unless it had a root canal. And sometimes when patients have root canals, I had a patient that had a root canal, put a crown, many patients, put a crown on it and it's still sensitive, and they come back and within 3 months just it calms down by itself. Why it calms down, we don't know. It just depends on how your body actually heals. All right, I hope this helped. We're out of time. Again, I'm sure I'm gonna make another video. I hope you guys like this setup a little bit better. It's not as maybe intimidating, but you know, we have to be careful these days. People are so sensitive. And I wish that the cats joined me. I thought they would because they drive me crazy every time I tape. They're all over the place, but I guess because I'm here, they don't want to even bother. So thank you for watching, and hope all is well, and I'll catch you in the next video.